Well, the big story that we are tracking, of course, is the sero-survey in the national capital. Now, these findings have in fact raised several questions about herd immunity in the national capital. Is Delhi inching towards herd immunity? What really does herd immunity even mean? But the new findings, according to this sero-survey, have indicated that herd immunity is perhaps or could perhaps be one of the reasons why Delhi's cases are falling. Now, official figures from the Health Ministry say that only 6.33 lakh people have been found to be infected with COVID-19 in Delhi. But the survey, the sero-survey, indicates that this total figure could actually be more than 1 crore individuals. This is an extremely interesting finding. To make more sense of what this means, let me first introduce the experts we have on the broadcast today. Dr. Rajesh Malhotra, Chief of the COVID Facility Trauma Center at the All India Institute of Medical Sciences. Dr. Yatin Mehta, the Chairman of the Medanta Institute of Critical Care. Thank you all very much for being with us. I want to begin by asking you, Dr. Malhotra, just before we get into the findings of the survey, could you just break it down and explain to our viewers what is herd immunity?
So, see, the thing is, whenever there is a pandemic, there is a susceptible population, and we know that the disease transmits from one person to other. What if the other person is already immune to that disease, and so that an infected person, when he goes out in communities surrounded all around by people who are immune to the disease, either because they have had it or because they are vaccinated, for whatever reason, they have antibodies to that disease or the cells which are competent to fight the disease, so that the disease cannot spread around, because the number of susceptible people around him is abysmally low. So this is the purpose of herd immunity, which means that the number of people who are susceptible around an infected person is so low that the what we call as the transmission rate is actually below 1, as they call it. R0 goes down so that the disease stops spreading.
Okay, Dr. Mehta, let's just look at the sero-survey findings. The Delhi sero-survey, the latest, was conducted on 28,000 samples. That's a decent sample size, many experts would say. And the survey found that 60% people were infected in one district, and over 50%, had antibodies across 10 districts of Delhi. What do these numbers really mean?
See, what it means is if 50 in one particular sample, now statistically you can always juggle around and say it is significant, not significant, but 28,000 is a good number to have. And it is reassuring in a way that we know that 50% of that sample population was already exposed to COVID. Most of them to a minor form of COVID, not a severe disease. So they already have antibodies to fight against COVID. That means half your population
All right, we seem to be having some trouble with Dr. Mehta. Dr. Mehta, can you hear us?
I can hear you. Right. So once the population is 70%, which has antibodies, then you reach herd immunity. That means the risk of transmission is significantly down. So between vaccination and getting the disease, I think we are heading towards herd immunity, which should protect us in near future.
The other big question, Dr. Malhotra, is that would this then be the reason why India's cases are falling?
There are two things, Rishika, I want to tell. One is it is a very logical and plausible explanation that why the number of cases are falling, because the transmission of the infection in the community is such an extent that people are immune to it. But while it is great news, I am not very excited about the fact because I think it is going to give a sense of security to the people who are vaccine hesitant. So I want to tell everyone very clearly that the immune response generated by vaccination is far more robust and as compared to the natural infection. And the reason is we know that the virus, when it gets into our body, it plays with our immune system. In fact, most of the side effects are because of the immune system going haywire. So a natural infection is not going to elicit that strong immunity. So while it means that maybe the transmission in the community is going down, it does not take away need for vaccination, which is still a must. That's a point, I think, which must be made clear even in the light of this sero-survey.
Right. Dr. Mehta, what does this survey findings, over 60% people having antibodies across 10 districts in Delhi, that's no small number. What does this mean for vaccine distribution strategy? Does it in any way change the strategy for vaccine distribution?
That means that no, it should not. As Dr. Malhotra rightly said, that the quality of antibodies and the amount of antibodies produced are much more with vaccination than with a naturally mild disease. So it is not the same thing. Antibodies in the body can be of different types. Neutralizing antibodies are the strong ones which neutralize the spike protein and give better protection. Now we are not measuring different types of antibodies. We are just measuring total antibodies. So vaccination is a much effective way to produce immunity and to reach herd immunity and reduce the extent of the disease and the pandemic to attenuate the pandemic. So that's what we should head for. It also means, it doesn't mean that we have been very effective in the past. That means at least in Delhi, a lot of people have had the disease.
Right.
So public health has not been that good if you look at it from that point of view.
Right. Dr. Malhotra, the other question, of course, that this sero-survey raises is that a lot of people, like Dr. Mehta was pointing out, have just had the disease, perhaps had a very mild form of it, not realized, been asymptomatic and recovered.
Sure, that would be the thing. In fact, if you remember, we had a talk about the CSIR survey where the 10% of their employees were found to be positive for antibodies without ever having shown the signs of the disease. So I think that's a encouraging thing, that the disease generally has not been as vicious as it has been in, say, for example, UK or USA. A lot of people have had asymptomatic infection, which again is a good thing. And I think this is the time when we can hit the virus hard. Now that it is finding it difficult to transmit between people and will try to change form and try to alter and mutate and hit us, I think this is the time to hit this one last time with a mass vaccination program to contain it forever.
All right. So that, of course, is, we've hoped to sort of make sense of this sero-survey finding that's been widely shared and talked about, not just in the national capital, but across, across the country. There's been a lot of interest in these findings. So we hope that, some of that has been analyzed and made sense of.